So, hi everyone. Last class we have discussed about the therapeutic ultrasounds model and how they are applicable to the skins and how they how the therapeutic ultrasound has been used. Now we can see the refracted rays of the ultrasound, reflection and refraction of the ultrasound, and rest others in second part, and mainly therapeutic effects and mechanism of ultrasound also. So Uh, so far, we have covered the basic topics of physics and principles of ultrasound. In the next part, we will discuss how. Next part means we now. It means now how we have how the ultrasound behaves inside the tissues and the therapeutic effects. In such case, first part is reflection and refraction. Reflection occurs when the ultrasound waves encounters the boundaries between the tissue with different acoustic impedance. Refraction is a bending of waves as they pass through tissue of varying densities. These phenomena influence how energy is distributed within the tissues or to the tissues, anything else. Now the absorption part, absorption is covered. Absorption is covered. Conversion of the ultrasound energy into heat within the tissues. The rate of absorption increase within the frequency, meaning higher and higher frequency produce more superficial heating, and lower produce more deep tissue penetrating heating. So attenuation refers to the loss of ultrasound density as it travels through tissue. This occurs due to absorption, reflection, and scattering. As depth increases, the energy level decreases. So, what is meant by scattering? It is an scattered effect of the tissues that may cause like steels and alloys, etc. What means the absorption? Absorption is the blood and gas tissues liquids in the human body that may absorb and be deep penetrated by the tissues. So the process of this is called attenuation. Switching to the thermal effect. Thermal effect includes increased tissue temperature, improved blood flow, enhanced metabolism, pain reduction, and increased tissue extensibility. Why this is why the ultrasound is often used before stretching and mobilization, because the effect of an after an stretching or enhancement may have may or may not be promote cellular activities before the functions of the mobilizations or etc. They can produce or promote cellular activity and tissue repair easily. Cavitation. Cavitation is the formation of oscillation of small gas bubbles in the tissue. Stable cavitation adds healing, unstable can cause damage. The acoustic cavitation is a transmitter of an ultrasound which transmits an energy from bubbles to bubbles in a cycle of process that reaches the unstable size to promote healing. The acoustic streaming. The formation of a microscopic gas bubble, stable cavitation promotes healing, while the unstable cavitation may cause tissue damage. The acoustic streaming movements of a fluid within the tissue that enhance cell permeability and nutrition exchange in an therapeutic effect. So clinical applications. Clinical applications. Ultrasound is widely used in soft tissue injuries, tendon and ligament healing, scar tissue management, chronic inflammation conditions such as OARA, etc. Ankylosing tendinitis. It works both tissue and cellular levels, healing and promotes healing as well as. So ultrasound is on higher frequency sound waves. It travels longitudinal waves. It works through acoustic energy. It produces thermal and non-thermal effects too. So while using the ultrasound to maintain the attention, it is of 1 megahertz to the deeper tissue and 3 megahertz in the superficial tissues, etc. So thank you for your attention. If you have any questions, feel free to ask. Thank you.